Okay, so now I'm going to show you how to find some traditional literature. And I'm not talking about the Renaissance herbals or the ancients because I don't think those are, sometimes they're digitized and even searchable. Well, maybe we'll look for Parkinson or one of the other Renaissance herbalists. But Henrietta Kress's site is a very good one because over the years, she has cut the binding off of many of the great eclectic works and other writings in the 19th century, early 20th century that were from physicians and practitioners who used herbs in their practice. So these are very, very valuable reference works. And so when you come to her site, don't try just searching her site for an herb because then it doesn't really work very well. I don't know. She hasn't apparently got her classic texts very well indexed. You have to see. It seems like you have to search them one at a time. So first go over to the classic texts like that, and you can see all these great works, quite a few of them, and even journals. The American Journal of Pharmacy from the 1880s, which do have a lot of articles on herbal pharmacy and herbs in general. And so one of the most important reference works, and she even has it highlighted there, I guess, King's American Dispensatory. And that's one of the most respected. So let's click on that one. And here is a list of all of the preparations that are in the work. And there are a lot of minerals in there, like arsenic. There are a few drugs like caffeine and so forth. They were beginning to creep into the pharmacies even then, even around the turn of the 19th century. The turn of the 20th century. So let's look up one here. But you can also see here's an aceticum, which is an acid, which is basically a vinegar. Well, acetic acid in this case, but they also make vinegars from other herbs and other substances. But let's take a look at yarrow, for instance. Here, I have a kind of a slow internet connection, so it's not instantaneous, unfortunately. And it depends on the time of day, how much traffic we have locally. I live out in the countryside after all, and which has its benefits for sure. But it could be that I think it's probably just taking time to load because maybe it's loading. No, it's not. Yeah, it's loading. Okay, so it just took time. But here's yarrow that's found, that was written, this summary and this experience was written up around the turn of the 20th century. You can see that they have somewhat of a history of yarrow. Pliny, who is an ancient Greek writer, states that the generic term Achillea was named from Achilles, a physician who was one of the first to use a species of this plant as a vulnerary. A vulnerary is a wound healer, something that staunches the wound, staunches the blood, and prevents infection, and also speeds up healing, like plantain, for instance. And then they have the chemical composition. I wouldn't pay too much attention to that because that's really outdated. But the action and medicinal uses and dosage are much more important. So it says King and Lloyd said that yarrow possesses slightly astringent properties and is tonic, alterative, and diuretic in infusion. So the dosage form is infusion. In other words, you pour boiling water over the chopped herb. Usually it's going to be the flowers and the leaves. And in this case, a tonic is something that just, in Chinese medicine, a tonic is some sweet herb that enhances your immune function and your digestive function and elimination. However, in Western herbalism, a tonic is taken to be a substance that just improves your metabolism and cellular function in general. So it's a rather general term. It's just beneficial for you, and you take it for a long time, maybe to get over an illness or convalescence, such as gentian, for instance. Alternative is somewhat similar. Alternative just changes your body chemistry and the cellular fluids that bathe all of our tissues and cells. It changes it for the better. And diuretic, obviously, is something that increases urine output and waste output from the urinary tract. So they're saying that it's used for chronic diseases of the urinary tract, or apparatus, as they put it. Exerts a tonic influence on the venous system, which means you might use it for quite a while for vessels and veins, like if you had hemorrhoids or varicose veins, for instance. And as well as on the mucous membranes, for instance, if you had a cold or cough or you had a lot of mucus. So more specifically, sore throat, spitting of blood, which is hemoptysis or hemoptysis, hematuria, blood in the urine, and other forms of hemorrhage where the bleeding is small in amount. So yarrow is always thought of as an herb that is good for staunching blood and reducing blood flow internally, and using it externally as a poultice to staunch the blood flow quickly. You can try and powder the leaf, for instance. So, and then related species that you can see here, and other species of Achillea, which are also used. So this is a fabulous resource. And again, you have all of these books and all of these herbs that are found in the King's Dispensatory that you can look up, and it has the common name and the Latin name, which is really great. So let's go back to Google, and next I want to show you some of the places to actually buy used books. So Bookfinder is one of the best. World's largest compilation of used books. And you can go to Bookfinder and you can type in the author, say King, John King, and you want to get King's Dispensatory, and you're going to search. Oh, but it's good to click on. Well, if you want a newer book, sometimes they reprint older books. So here are all the King's American Dispensatories that you're seeing here. There are quite a few available. Some are going to be new and some are used. If they say new, that means they've been reprinted and rebound. So they're basically photocopies in a way. And then they maybe put them in a hard binding. So what I didn't do back here is click used and out of print, and that will get you an original copy. However, a used copy is going to be probably a lot more expensive because a used copy means the original work from the early 1900s. Whereas, and I see there's only one used copy available. All the other ones were reprinted, and so those are going to be a lot less expensive. So they're searching here. Now, another trick, if you're looking for the PDF file of an entire herbal, say we're looking for Dioscorides, Materia Medica, and then just type PDF after it. So any book you're looking for, if you type PDF, you're more likely. And then you see here in the search results that there's there are the letters PDF in brackets, and that shows you that it is a PDF file that you can download perhaps. And then you have Google Scholar. So let me show you Google Scholar, which is no doubt the most important search engine for science anyway. So Google Scholar. Here's Google Scholar. You should have that bookmarked practically. Now, if you're searching the scientific literature for any herb or many different facets of herbal medicine, and you want to find out what are the best growing conditions for valerian, or what are the active compounds, or are there any clinical trials, anything at all that you might want to know, you want to go to Google Scholar, and that's going to search the scientific literature in a rather free-form way. I'm also going to show you PubMed, which is a less free-form way. It's a lot more compartmentalized, you might say, and has a lot. It's a lot narrower in its search capabilities. So let's type in valerian, say, and sleep, and see what we get. Okay, here's now when you're looking at the entries to help you kind of sort out what would be useful versus what isn't. First of all, you want to look for several things. You want to look for the journal title, and is it a book? Is it a journal article? What type of a publication is it? So here you're seeing American Family Physician. This may be older. Here's maybe a study, efficacy and tolerability of valerian extract. So this is a commercial product compared with oxazepam in the treatment of non-organic insomnia, a randomized double-blind comparative clinical study. And then they give you some information about it here in a very brief abstract. Now you can mark it as a favorite here. You can save the article, and again you'd have to probably sign into Google and have a Google account in order to save it to your Google account. You can cite it, and by citing it, I'll just do that, it shows you in different formats how to cite it. So for instance, Chicago format or Harvard format is a type of publication format that you can just copy that and paste that into your bibliography. On the other hand, if you have one of the bibliographical software packages, like I have EndNote, which I use, this will automatically, you just click that link, and that will automatically put the reference and abstract into EndNote, and that is a fantastic database of all your references. So perhaps if you're not a writer or a researcher, you don't really need EndNote. It's probably a couple $100 or something like that. But if you're doing a lot of writing, it's crucial, because you can, in Microsoft Word, you can cite as you write, and that means you could be typing along a sentence like, valerian is said to be good for, or was studied for sleep and found to be effective, and then give some details, and then you could put the reference right into Word by clicking the EndNote link, or if you had RefMan or BibTeX, those are other ones, but EndNote is probably the most popular and fully functional and interacts with Word, and then it just puts it right in automatically into your Word document, and then puts the reference at the end of the document so that you can refer to it later. Or when you print out your article, for instance, it will have your reference list already formatted and already finished in the back, and it will insert, for instance, the lead author's last name, comma, date. So that's often done, the author's last name, the first author's last name, comma, date. Or in some formats, it would be like Ziegler et al., comma, 2000, and in this case, it'd be 2002. So this is incredibly valuable if you are a writer or researcher. I'm not sure how many of you have bibliographic software or need it, but I just wanted to show it to you. I'm not sure, you could, maybe one of these would be less expensive, but it is very, very useful. Of course, Word has its own ability to create an automatic reference list, so of course you can use that. But again, you can simply copy this format here and paste it into your Word document at the end, and then just cite Ziegler et al., 2002 in the paper where it's appropriate, where you make reference that valerian was studied and found to be good for sleep. So, and you can see a variety of other ones here too. Now, another thing to pay attention to in Scholar is if you, here's some related searches, so that might be good. Maybe you would get something else if you looked for meta-analyses for valerian for sleep. That means that researchers have taken and looked at a lot of the published studies on valerian, and then they're going to statistically determine whether the evidence is strong for using it, valerian for sleep in this case, or not, or whether it really doesn't have enough, say, good scientific support for using valerian for sleep. So you could do that search. And here are other searches. Here's a fixed valerian hops sleep disorder. That probably has valerian in it as well. So there's a product that has hops and valerian for sleep disorder, and they probably have a clinical trial on that. And then here is one where they use polygraphy, which is looking at the brain waves, I guess, and giving valerian and seeing how it affects your brain waves, whether it puts you in a deeper sleep, which I know there was a study like that done. And then a systematic review for valerian for sleep would be useful as well. That's going to be a more narrow type of search, which is going to show you, okay, here's a systematic review and meta-analysis. Here's valerian for insomnia, a systematic review. That means that they are looking at all the published articles out there and studies that have been done on valerian and kind of summarizing them. But they doesn't usually have the statistical part like meta-analysis does. Is more math involved, basically. Now, another thing to really note about Scholar that's important, that you'll find very useful, I certainly do, and that is you can look over to the right here and you can see which articles have the full text article available. Now this one, if you click on it, you're only going to get this one here. If you click on it, it's going to take you to the publisher's website. In this case, the publisher is Sleep Medicine, or the journal is Sleep Medicine. The publisher is Elsevier. And this is the Science Direct database that's showing it to you. So in this case, you can only read the abstract, which is good many times, but the only problem with the abstract is they often don't give you or show you how much was used, how much of the valerian extract was used in the trial, and what about the preparation. Was it an extract? Was it the dried root as a tea? How was it administered to the volunteers? So that's also something that you want to find out about, of course, if you're interested in valerian and you want to know more about how it was used in these clinical trials and how effective it was. On the other hand, if you go back to here, these full text articles are available. So here's one right here, Valerian for Sleep, a systematic review and meta-analysis. Let's click that. That was in 2006. So you're looking at these details, the journal, the date it was published. Is it a more recent article? Because the older literature, like if it was from 1985 or something, that's not going to be as valuable typically. I mean, it might be interesting to read, but their methodology typically was not as good as the current methodologies that are used. So if you're seeing 2015, you will probably want to use that article, because anything in the last 10 or 15, even 20 years is certainly more useful than an article back in the 70s or 80s or even earlier. So here you're seeing the entire full text article. This was published in the American Journal of Medicine, so that's okay, that's fine. that journal probably has a good rating. So ranking, you might say, journal ranking ranks how many people cite the articles in the journal and other parameters. So what you can also search for a journal and its ranking, so the American Journal of Medicine is going to have a higher ranking than some obscure journal from China. There may be some really good journals from China that do have high rankings, but there are many smaller ones like from India and China, which are kind of local and not well known, not well cited, and they're going to have a lower ranking. So here you see the HTML article, which has the tables, has a kind of a summary of the studies that were done. I guess you can't really expand it too much, but it tells you, I can move over here, see it tells you the results, and it tells you the dose and how many days, and the type of population, the type of patients: healthy subjects, elderly women with insomnia, healthy subjects with insomnia, children with intellectual deficits and sleep disturbances. And they tell how many people were in the study and the outcomes again. And then they have links to the actual articles here. So this is very useful if you're wanting to understand the scientific basis for valerian extract for sleeping problems of various types. And again, you could be satisfied just saying, well, the eclectics say valerian was good for sleep, and the ancients say valerian was good to sleep. That's good enough for me. And then you could use it and try it. But if you look at the science, and if you're a practitioner, I'll say, or if you're someone who really needs a higher standard of evidence to go along with the traditional body of evidence. I'm not saying the traditional body of evidence isn't good. It is very good and can give us a lot of clues about how to use herbs, particular herbs, and for what type of conditions and how safe they are. However, if you want to pinpoint it more, you can see here that it had the studies that they're reviewing, elderly women with insomnia. So you're not going to be able to understand how valerian works for different types of people, like women versus men, or older versus younger people, or people who wake up easily. They fall asleep. They fall asleep easily, but then they wake up after an hour or two and they can't get back to sleep, versus somebody who can't fall asleep easily at all, and it takes them, say, an hour or two to get to sleep, or people that have a lot of stress in their life or whatever. So the ancients and the eclectics didn't have the sophisticated differential diagnosis that we talk about, that we have today. And so we can incorporate, and this is what I like to do. I like to use it all. I like to understand how the ancients and how the eclectics and how the Renaissance herbalists used an herb in their practice, what kind of results they got, if I can find out, what kind of dose they used. Then I want to add the scientific piece. I want to find out, is it good for some types of people versus others that have sleep problems? What doses did they actually use in the clinical trial where they got results? So maybe they used 300 milligrams of a 5-to-1 extract of valerian rhizome and root, and it didn't work. But when they used 1,000, or they used 2,000 milligrams, say 2 grams a day, you can usually get about 500 milligrams per capsule, then that's much better, because you can know exactly what the dose would be that was shown to work in particular populations of people for valerian for sleep. And it also might talk, I'm sure these articles also say, well, it was well tolerated. In other words, there weren't any particular side effects that they could note, like upset stomach or headaches. And also, what type of preparation was it used again? Was it a tea? Was it an alcoholic extract like a tincture? Was it extracted with hexane or some solvent, which typically we wouldn't use, of course. Herbalists don't go for that too much if it's solvent extracted, except for ethanol. But it just tells you so much more, and then you can put the whole piece together. Now, the other piece, of course, is traditional medicine. You can find out how it was used in traditional Chinese medicine. Valerian wasn't used by the ancients because they didn't, well, it probably was, but I don't know if it was used for sleep. It's not a major Chinese herb anyway. So what's so great is you can get all of these different sources of material and you can put it together. Now, that's a lot of work, of course, so who wants to do all that reading and researching and everything? Well, that's what I do. That's what I've been doing for years and years, is that I'm a knowledge glutton, and I want to get as much as I can and as the best, highest quality information that I can. And hopefully there are other writers out there, I'm sure there are, other writers which do the same. They really look at all different sources and they try to put that together and come to some conclusion. Well, Valerian definitely is well supported by from the ancient literature and practitioners in the Renaissance and the eclectics, and by science, by actual clinical trials, not just in vivo or in vitro studies. Remember, when you're looking at these studies on Google Scholar or PubMed, make sure to differentiate in vitro studies, which means they're just probably studying the herb extracts or some chemicals in the herb that they've isolated, like for instance the valeranone in valerian. They've isolated that, and now they're testing it against different cell lines, maybe human cell lines. So it could be quite useful, maybe nerve cells or something. So there are in vitro studies, which are basically in glass in test tubes. Then there is in vivo studies, which means they are typically extracting the valerian or a chemical out of valerian and injecting it into rats. Mice typically are the most common by far, but sometimes they use other animals, and sometimes the extract or the herb is given orally, which is certainly much better than injection, in my opinion, and because that's how we're going to use it. But you can't always compare in vivo and in vitro studies with how it's going to work in humans. That's why I scan through literature like that, but I'm the most interested in clinical reports, clinical case reports, or clinical trials, or of course review articles, which maybe review all the literature, all the research that's been done out there. Those are very valuable. So let's leave Google Scholar now